Your healthcare team recommends that you have a central venous catheter, commonly referred to as a CVC, to help with your treatments. Having a CVC requires that you do CVC Care every day. The infusion therapy team will teach you or your caregiver how to do safe CVC care at home. This video helps reinforce the information you learn in the CVC Care class and serves as a resource for you and your caregiver to use at home. First, let's take a look at the different types of CVCs. A CVC is a small, thin, flexible tube placed into a large vein in your body. The word CVC is normally used by your care team if the catheter is inserted in the chest, either above or below the collarbone. If the catheter is inserted in your upper arm, it is called a peripherally inserted central catheter, or PIC. The location of the catheter often depends on the treatment type, length of treatment, and medical history. Your provider will decide which type of catheter is best for you. All catheters have the same basic parts, and it is important that you are familiar with these parts, which include the catheter, winged hub, catheter lumen, catheter clamp, and a needleless connector cap. Your catheter will stay in place for the length of your treatment as long as it flushes well, gives good blood return, and the skin around your catheter remains healthy. Once your treatment is completed, you can talk with your doctor to see if your catheter is still needed. Your catheter can be used to give different types of IV treatments or therapy. These include chemotherapy, blood products, medicines, fluids and IV nutrition, as well as treatments like stem cell collection and photopheresis. The benefit of having a CVC or PIC is that it may be used over and over again without needing a new IV placed for every treatment or test. Also, depending on the type of catheter, it may be used to draw your blood for blood tests, if approved by your care team. However, certain situations may require that you have an IV placed in a vein in your arm for some treatments or tests. It is important that you practice and maintain good CVC care to help reduce your risk of developing a central line acquired bloodstream infection, also known as CLABSI. CLABSI is a life-threatening infection that occurs when germs, usually bacteria or fungus, enter the bloodstream through the central line. To help prevent CLABSI, always wash your hands before touching your catheter. Use disposable gloves and a mask when handling your catheter. Practice good hygiene and bathe every day. And perform proper CVC care at home. Proper CVC care includes flushing the catheter daily, changing the cap once a week, and changing the dressings within 7 days or more often if needed. You or your caregiver must attend a CVC Care class and demonstrate CVC Care to an infusion therapy nurse. The nurse will make sure you know how to care for your CVC properly before you can do your own CVC Care at home. It is important to do your CVC Care in a clean, dry, pet-free, and quiet area. Choose a comfortable space with good lighting. Make sure you have easy access to your catheter site and a table that is large enough to lay out all the needed supplies. This will be your workspace. Clean the table with an antibacterial cleaning wipe. Be sure to follow the instructions on the label for proper use. Before you handle the catheter or perform any CVC care, wash your hands well with soap and water. Follow these steps. Wet your hands and use enough soap for a good lather. Rub your hands together using friction for 20 seconds. Scrub all areas of your hands, including fingers. Then, rinse well with water. Dry your hands with a clean paper towel. Use a paper towel to turn off the faucet to keep your hands clean. This segment will show you how to flush your central line catheter. Your central line catheter should be flushed every day to help prevent infections and keep it from getting clogged. Let's go over the parts of the flush syringe. There is the plunger, wings, barrel, and a protective cap at the end. To flush the catheter, follow these steps. Gather your supplies. 1 pre-filled 10 milliliter syringe containing normal saline solution. You will need 1 syringe for each lumen of your catheter. CHG swab. You will need 1 swab for each lumen. And non-sterile gloves. Next, wash your hands with soap and water for 20 seconds. Dry your hands and put on the non-sterile gloves. Check the label on the syringe for the following information. It should list 0.9% sodium chloride, 10 milliliters, and the expiration date. Make sure the lumen clamp is open. Remove the white protective cap from the syringe. Pull down gently on the plunger to break the seal. Clear the air from the syringe by pushing the plunger up gently until you see a drop of fluid at the tip. Be sure not to touch the tip or lay the syringe down. Using the CHG swab, scrub the tip of the needleless connector for 5 seconds. Allow at least 5 seconds to air dry. Do not blow on it, fan, or shake it while it is drying. Be sure not to touch the end of the needleless connector after you have cleaned it. Carefully push the syringe into the needleless connector cap and turn the syringe clockwise until the connection feels secure. Try to push in a small amount of saline. If you cannot push the saline, stop. Check the lumen clamp and make sure it is open. Next, check the syringe and make sure it is connected securely to the cap. If you are still unable to push or feel resistance, stop. Do not force the flush. Remove the syringe, throw it away, and contact the infusion therapy clinic for further instructions. If the saline flows in without resistance, use the push-pause method to flush your catheter. Push a small amount of saline. Pause. Push another small amount. Pause. And repeat until the syringe is empty. When the flush is complete, hold the connector cap with one hand and carefully remove the syringe with the other hand by turning the syringe counterclockwise. Make sure the connector cap is still on the catheter tightly. Throw away the empty syringe into the trash. If your catheter has more than one lumen, repeat the steps for flushing each lumen. The infusion therapy team will tell you if you need to flush your catheter with heparin instead of saline. If you do, you will follow the same steps for flushing the catheter using a pre-filled heparin flush syringe. Be sure to check the heparin syringe label, dose, and expiration date before you flush your catheter. This segment will show you how to change the needleless connector cap. Your cap should be changed every 7 days or sooner if blood is present in the cap. The cap can also be changed if your provider is checking for problems. You will need the following supplies for the cap change. 1 pre-filled 10 milliliter syringe containing normal saline solution. You will need 1 syringe for each lumen. CHG swabs. You will need 3 pads for each lumen. Needleless connector cap. You will need 1 cap for each lumen. Non-sterile gloves. And a mask for the patient and 1 for the caregiver. To prepare the new needleless connector cap, follow these steps. Remove the saline syringe from the package. Be sure to check the label, dose, and expiration date. Loosen the white cap, but do not remove it. Set the syringe aside. Carefully peel open the new cap package and pull off the paper backing. To remove the new cap from the package, pick it up in the middle without touching either end of the cap. Clean the tip of the cap with a CHG swab for 5 seconds. Allow to dry for at least 5 seconds. Do not blow on it or fan or shake the cap while it is drying. Remove the white cap of the saline syringe and then carefully attach the syringe to the hub end of the cap. Turn clockwise until the connection feels secure. Pull down gently on the plunger to break the syringe seal. Then, push the plunger up gently to push out air from the syringe. Keep pushing until you see a drop of fluid in the blue tip. Place the primed cap syringe onto the cap package and set aside. To change the needleless connector cap, close the catheter clamp. Clean the outside of the old cap and lumen with a CHG swab for 5 seconds. Allow to dry for at least 5 seconds. Do not blow on it or fan or shake it while it is drying. Turn the old cap counterclockwise to remove the cap. Be sure not to touch the opened end of the lumen. Always keep the lumen facing downwards. Open a new CHG swab and wrap the pad around the end of the lumen. Clean it for 5 seconds. Allow at least 5 seconds to air dry. Do not blow on it, fan or shake it while it is drying, and do not let go of the lumen. While holding on to the cleaned lumen, place the primed cap syringe between 2 other fingers in the same hand. Remove the blue tip of the new cap. Make sure not to touch the open end of the cap and lumen. Insert the primed cap syringe into the lumen and twist the syringe clockwise to secure. Open the lumen clamp and flush the remaining saline using the push-pause method. Hold on to the new cap and twist the syringe counterclockwise to remove the empty syringe from the cap. Never reinsert a connector cap that has been removed. Always replace with a new, sterile, needleless connector cap. This segment shows you how to do a CVC dressing change. Dressings are usually changed within 7 days. Some may need to change their dressing more often. Dressings should be changed right away if it becomes dirty, wet, lifts around the edges, or if you feel discomfort. To prepare, follow these steps. Find a clean, pet-free, and quiet place with a table. Avoid the bathroom and kitchen. Clean your workspace with an antibacterial cleaner. Place a clean towel under the arm or under the shoulder where the catheter is inserted. Gather your supplies. You will need a dressing kit, a dressing, adhesive remover, non-sterile gloves, and a mask, one for the patient and one for the caregiver. Wash your hands and scrub well with soap and water for 20 seconds. Dry with a clean towel. Use a clean paper towel to turn off the faucet. Now you are ready to remove the old dressing. Follow these steps. Put on clean, non-sterile gloves and masks. Use the adhesive remover to carefully remove the old dressing. Start by removing the label. Next, remove the securement strip from underneath the tubing. Then, pull the rest of the dressing off towards the insertion site. Keep the dressing close to the skin as you pull it off slowly. Check the catheter site for rash, redness, swelling, discharge, and/or loose or missing stitches or sutures. If you see any of these problems, finish the dressing change and call the infusion therapy clinic. Take off your gloves. Cleanse your hands with hand sanitizer or soap and water. To open the dressing kit, follow these steps. Open the package and remove the kit. Place the kit on a clean table. Open one flap of the wrapped kit to remove the sterile gloves and hand gel. Place the sterile gloves and hand gel in an area away from the dressing kit. Before you put on the sterile gloves, carefully open the rest of the wrapped dressing kit. This is your sterile work area. Make sure you have everything you need in the dressing kit. Carefully open the dressing package and let it fall onto your sterile work area without touching the dressing. Next, follow these steps to put on the sterile gloves. Carefully open the glove package. Clean your hands with hand gel or wash again with soap and water. Dry hands well. Next, pick up a glove by the cuff with your non-dominant hand and insert your dominant hand into the glove. Then, with the gloved hand, pick up the other glove by placing your gloved fingers under the cuff. Slip glove on the other hand. Be very careful not to touch anything that is not sterile with your gloved hands, such as your skin, clothing, tabletop, and lumens. Only touch what is in the sterile kit. If you accidentally touch something unsterile with a gloved hand, change gloves right away. Now, follow these steps to clean the insertion site and apply a new dressing. Arrange your supplies. Start with the package that contains the chlorhexidine alcohol swab sticks. Cut off or tear the top of the package. Insert 2 Q-tips into the package to use later. To begin cleaning, take 1 large swab stick and scrub the insertion site using a back and forth motion. Then, continue towards the winged hub and stitches. Next, continue scrubbing the skin back and forth around the catheter. As you scrub back and forth, you will move outwards in a circle pattern away from the insertion site. Do not go back over the areas that have already been cleaned. Be sure to clean the entire skin area that is covered by the dressing. Use each large swab for at least 10 seconds. You will repeat the same steps for each large swab. With the remaining 2 Q-tips, clean only the insertion site, stitches, and underneath the winged hub. Let the site air dry for a full 2 minutes to help prevent infection and keep the skin from getting irritated. Do not blow on the area or fan it while it is drying. Open the skin barrier package. Remove the swab and wipe a border, starting 1 inch away from the catheter. This helps to keep the skin from getting irritated from the dressing. Allow 1 minute to dry. Do not blow on it or fan it. Do not put skin barrier near the insertion site or hub area. Next, apply the dressing. You want to make sure the dressing is on well and feels comfortable. To do this, if the catheter is in your arm, fully extend your arm out straight. If the catheter is on your chest, turn your head to the opposite side of your catheter and place your hand on your hip, pulling your shoulder back. Apply the dressing. Place the BioPatch disc over the insertion site with the blue printed side facing up. Center the dressing so that the insertion site and disc can be seen within the clear window for the dressing. Apply the securement tape under the tubing and overlap the bottom edge of the dressing. On the label provided, write the date, time, and the initials of the person who changed the dressing. Place the label along the lower edge of your dressing and cover it with a strip of clear plastic tape. You are finished changing the dressing. When you shower or bathe, do not get the catheter wet or put it under water. Cover the catheter and extensions with plastic. Secure the edges with adhesive tape. Let's review some of the most important details about your CVC Care. Make sure you have a clean workspace and you use proper hand hygiene before handling your CVC. Make sure you have all the supplies you need. Always keep the dressing dry and intact. When bathing, apply a plastic wrap over the dressing to keep it from getting wet. Dressings are usually changed within 7 days. Some patients may need to change their dressing more often, depending on dressing type and cleaning solution. Change the dressing right away if it becomes dirty, wet, lifts around the edges, or if you feel discomfort. Change the connector cap once a week. Flush each catheter lumen every day. If your CVC was recently placed, you may see some bruising or have soreness. This is normal. Watch for signs and symptoms and contact the infusion therapy team right away if you have redness, pain, or drainage from the catheter site or skin around your catheter. Catheter site feels very warm or hot to the touch. Fever of 100.4 degrees Fahrenheit or higher. Tenderness or swelling around the insertion site that is new. Leaking or broken catheter. Unable to flush catheter lumens, or loose or missing stitches. This video is also available to watch in your MyChart account. If you have any questions about your CVC Care, talk with the infusion therapy team or refer to the CVC patient education documents on MyChart.